get pneumonia, die. Even these children that they're talking about with the swine flu, it's a higher incidence of severe cases in children. They're not healthy children. They're mostly, they have heart conditions, they have asthma, there's huge correlations there. So it's, you know, you have to really consider the specifics of the state of the individual. There is if you go on YouTube, you can search under Dr. Oz, even famous Dr. Oz, who's on, in the media promoting the vaccine. His wife and children are not receiving the H1N1 vaccination this year. So you can ask him, why not? I don't know, he hasn't said exactly. So there are, the things that I recommend are weighing these factors and making an informed choice. I think you can tell where my argument is going is that if you're, what's not a very difficult decision is if you're a healthy person without vitamin D deficiency and you're eating a healthy diet and you don't have a lot of health complications, the argument for getting a vaccine becomes very, in my opinion, flawed. It becomes a little more, a little less black and white in special cases. However, these special cases, kids with asthma, people with different kinds of problems, those people are maybe more likely to become sick, but they're also more likely to become sick because of a vaccine. They're more likely to be sensitive. So it's kind of a, it's not an easy answer there. There are certain things that are very easy and clear cut. Vitamin D is a significant factor in immune system response. So if your levels of vitamin D are low, you're at a much higher risk of getting a cold, a flu, an infection, many different kinds of cancer. It's a no-brainer. Get your vitamin D levels checked, and if it's low, take vitamin D. You can, and the RDA recommendation for vitamin D is extremely low. The 400 IUs a day will never get your levels up high enough if you're low. Most people need to take upwards of 5,000 or 10,000 IUs a day to get their levels back to normal, and then at that point they'll need to continue to get their, you want to check your levels, take a certain amount of D, and then continue to recheck it. So that over, maybe 2-3 times a year. Then after a year or two, you'll be able to figure out how much sun exposure you need and how much vitamin D you need to keep your levels at a normal, healthy level. The levels are on the test are skewed. You want your vitamin D levels should be more like between 50 and 65 on the 25-hydroxy test for vitamin D. So even if you fall in the normal range, you should be on the higher end of normal, which is 50 to 65. If you're going to take vitamin D, you should take it in the D3 form, and the liquid form is going to be absorbed the best. You want to avoid the D2 form. It's not quite as absorbable by the body. Most prescription forms of vitamin D are the D2, the inferior form, so you want the D3 form. And if you don't have access to the test, for most people, a pretty safe dose is 2,000 IUs per day. You could do that, start that today immediately, and then get your blood levels checked as soon as you can. The 2,000 IUs a day is not likely to be toxic, especially if you just do it for a few weeks before you're ready to get tested. But it's not the best idea to just be taking high doses of it without really checking your levels. The best way to get vitamin D is from the sun, and most people don't spend enough time in the sun, and they're using sunscreen too much. So it depends on your skin type, but for as a general recommendations, 20 minutes a day, as close to every day as you can, of unfiltered, unsunscreened sun exposure is a good place to start, and then get your levels checked from there. So I avoid telling people exactly what to do with the vaccine, but I recommend that people become educated and make the decision for themselves. As far as one other thing, just in terms of diet and lifestyle, more fruits and vegetables, healthier diet, making sure you're exercising, getting fresh air, getting sunlight, and also there's a homeopathic remedy called influenzinum or influenzinum that I strongly recommend. I have recommendations on that. If you want to send me an email, again, just go to the website, progressivechiropractic.com. You can email me at dre@progressivechiropractic.com, and I can send you those recommendations. Then there are several other homeopathic remedies that are very useful that can be used in addition to the influenzinum, things like mucococcinum, engestol, and oscillococcinum. These homeopathic remedies are also useful to prevent the colds and flus. Less effective to treat them, but somewhat effective. So you can use those at the first signs of a cold or flu, and then if it's not responding, you want to move to a more specific homeopathic remedy that's addressing that particular state of that illness. If you can find it for yourself, great, but if you start running a higher fever or the symptoms are becoming more severe, then you want to contact an actual well-trained homeopath to treat those. And these diseases are very easily treatable, like we talked about before. Pneumonia is not difficult to treat with homeopathy. It doesn't necessarily require an antibiotic. If there are cases when you're prescribing remedies for patients with pneumonia, for example, their fever's not coming down, they're not getting better, then yes, an antibiotic is better than death. But the homeopathic remedy is better than the antibiotic if you can find it and if you can get it to work. Yes.
So what did you say was a good daily amount for vitamin D for just a regular?
Right, for a recommended daily dose of vitamin D, I don't really recommend taking any amount of vitamin D unless you get your levels tested. But if pressed, like people are always doing with me, I would say that 2,000 IUs a day is generally not going to be toxic, especially if you're only doing it for a few weeks or a month or two or a few months. It is probably also not enough to go out of a severe or very low deficiency state into a healthy normal state, but it's certainly better than nothing until you can get your levels checked.
And when do you get them checked?
It's a very standard conventional blood test to get your levels checked. It's the 25-hydroxy or 25-OH vitamin D level test. This is not some sort of way out there, poorly understood test. It's very available in most, in any medical doctor's office. You can just go to a lab or go to any doctor's office or chiropractor's office or naturopathic doctor's office where they draw blood and you can get it tested. So it's not a difficult thing. Excuse me?
Do you do?
I don't draw blood in my office. I don't like drawing blood, so I don't do it. But I recommend ideally getting your levels checked at the end of the summer, and then again at the end of the winter. So because you may need a little less in the summer and a little more in the winter. Again, the best way to get any vitamin is from natural sources. So if you can get it from sun, and if you can get all your other vitamins from food, that's the best way to do it. And then you look at these supplements as ways of making up for the gaps in an otherwise imperfect world that we live in.
And just a reminder to those who are sitting in a window thinking they're getting sunlight, that the windows and car windows and building windows do filter out the rays that you need.
Right, there's UVA and UVB, and the windows filter out some and not others, and so direct sunlight is the best way to get it without sunscreen for approximately 20 minutes a day. Extremely sensitive people will need to build up to that if they're very fair skinned, and darker people will need more than that, but that's a general recommendation. Yes.
This is probably kind of silly, but I mean, would somebody who's sitting outside with like a full coat on be better off than someone who's not wearing much of anything but has like sunblock on?
Well, the more, that's difficult. So the question is, what's the difference between, like if you have just your face exposed without sunblock versus your whole body with sunblock? I think that's kind of the question. I don't know the answer in terms of exactly to what degree, but the ideal thing to do is to take 20 minutes of sun close to every day with as little clothing on as possible. The more skin that's exposed, the more vitamin D you're absorbing. And even the organs below the skin are benefiting from that skin exposure. So totally nude sunbathing, at least some of the time, is the best way to go. And in 20 minutes you're not going to burn, but you're going to develop a little bit of a base, which provides additional SPF. Just having a tan is SPF, it's natural SPF. Any other questions on? Yes.
How do you feel about, and I'm probably going to brutally mispronounce it, the oscillococcinum?
Yeah, oscillococcinum.
Yeah.
That's the one I was mentioning. I like to refer to it as oscillo. It's easier to
Oh,
pronounce.
okay.
But oscillo or oscillococcinum is available in most drugstores and pharmacies, and it's a homeopathic remedy that has it does a reasonable job of helping to prevent cold and flu. So that's another one that you could take for prevention. You could take it about once a month during the cold and flu season. And at the earliest sign of a cold or flu, you could start taking it a little more often if there's not any really characteristic symptoms, which we'll talk about today. What are characteristic symptoms in terms of homeopathy prescribing? If there's not really any characteristic symptoms, then something like oscillo can help somewhat. It's not going to be really dramatically curative the way a specific homeopathic remedy would be, but it's going to help. It's going to help most people somewhat.
Do you have anything to say one way or the other about like full spectrum lamps?
Full spectrum lamps. Full spectrum lamps don't, you're not going to absorb any vitamin D from them. You will from certain tanning beds if they have the UVA and B, and so using those in moderation is better than nothing, better to get natural sunlight, but a little bit of that could be a beneficial thing. The full spectrum lights, I think that really has more of an effect on the even with seasonal affective disorder, I'm not so sure. Maybe somewhat. Not really an expert on that, but I think it's more of a mood thing, and there's some hormones that are released associated with certain wavelengths and spectrums of light. So it is a healthier alternative to traditional light bulbs, especially fluorescent. But it's not gonna have a significant impact, I don't think, on vitamin D levels or seasonal affective. Except in some people, there are special lamps that you can get, but it's not. It's different than just having a full spectrum light bulb. So there are boxes, those light boxes, that can be very effective for seasonal affective disorder, and there's certain lights that you can buy that will allow your body to absorb or make vitamin D from. So those do exist. But buying like a full spectrum light bulb, like that you just screw into a lamp, is not going to do it. Anything else? Okay, so we're going to get back to the outline for the course. And I just want to reiterate a point from last time. We talked about herbalism and how herbology and the use of vitamins and minerals is different from homeopathy. And I just want to make the point that using herbs is not necessarily a bad thing. It's just that if you can trigger the body's healing response to do it on its own through the use of a homeopathic remedy, tends to be a better outcome, not just in the short run, but also in the long run. When you trigger your body's response to do the healing, you tend to be less susceptible over the long run. So you could treat a cold or a flu with echinacea, for example, and that will stimulate the immune response, and you may get a good result, but you're not going to be any less likely to get that same cold or flu in the future. Whereas if you use a homeopathic remedy to do it, you'll be less likely to develop that. You'll start to build an immune response, and you'll be less likely to develop that illness in the future. Pretty much across the board, the more you're treated with homeopathic remedies, the less likely you are, the less susceptible you are to not only that specific disease that you just treated, but just globally. You're making yourself healthier each time you effectively treat yourself with homeopathy. And there's a place for conventional medicine too. I mean, I absolutely refer to, I have a lot of conventional medical friends and colleagues, and there are absolutely appropriate times to make that referral. Mainly when, for whatever reason, you can't find a good homeopathic remedy to trigger a healing response. If you can't do it, and the person's very sick, that might be something that you have to do. So it's more dependent on whether or not you can find a remedy than what the illness is in the first place. It's not like a more serious illness needs conventional medicine. It's just if a more serious illness is not responding to homeopathic remedies and other means, you may need that. But that's more of a, it's either a personal failure of the doctor, which can happen, or sometimes you just can't find characteristic symptoms of a disease. Sometimes it can just be too difficult to do, and you need that. But other instances, it would be for fractures like that are non-union. I mean, you know, orthopedic surgery is often necessary, but there's a lot of cases, you know, where it's not. So it just depends. Just so I don't forget, as for homework for next time, I want you to reread a paper, What is Homeopathy, or a brief introduction to homeopathy, which we talked about a little last time, we'll talk about it a little more today, but I recommend rereading that several times so you really have a grasp of it. Okay, so last time we ended around, we were talking about the brief introduction to homeopathy, the paper. So I want to just hit a few high points from there. Under what homeopathy is not, like we talked about, it does not specifically involve the use of vitamins, minerals, and herbal therapies, but that may be part of an overall treatment plan incorporating homeopathy, the homeopathic remedies, along with some of these other things. In homeopathy, we do not treat disease or suppress symptoms. We treat the patient and try to boost the patient's immune response or overall healing response in order to overcome the disease. Homeopathy's success does not rely on the placebo effect, which we'll talk about in just a little bit. And lastly, homeopathy is not an unproven science. There's a lot of literature and research that supports the efficacy of homeopathy. So back to the outline under I, we come to the section on provings. So the materia medica, the body of knowledge, the information that we have about each specific remedy, that's what the materia medica is. It comes from three different things: provings, toxicology reports, and clinical data or cured cases. So the information we get from provings for the remedies, what provings are is you give a crude substance, a substance that's undiluted or just minimally diluted, to a healthy patient. And this was done, most of the provings were done in the 18th and early 19th century. So most of the remedies we have in the materia medica that we use the most are close to 200 years old or more. So the provings are, you give ideally sensitive patients, so you can get a lot of symptoms. You give a sensitive patient, someone who's going to react a lot to the substance, one of these substances, and then you just meticulously record all of the changes that the patient's noticing. And the patients that are doing this are ideally very well trained, and were at the time, to be very, very detail oriented, so that if they took a remedy and they felt worse and they were waking up and having restless sleep, that wasn't good enough. It's what time, exact time. They'd be looking at their watches. It's 3 a.m. and I'm awake right now and I have this sensation and that sensation. And doing this, round the clock until the effects of that medicine wore off. And then when it would wear off, they'd repeat the remedy, or they'd take the substance again and do it again, sometimes 2 or 3 or 4 times, to confirm that the original symptoms they got from that proving occurred again, and it wasn't just due to chance. And then you give that same substance to someone else, and to someone else, and to someone else. And you start to develop a database of all of these symptoms. And when everyone who's taken the symptom, or the majority of the people have taken that substance and have that symptom, that gets a higher weight. And so there's a hierarchy that's reported in the literature as well. So not just, symptoms may include, or side effects may include these symptoms. It's a hierarchy. It's what are the most common symptoms that develop when we take a particular remedy, and what are the most intense symptoms. So not just a mild sensation, but an intense. So if someone took a particular remedy and it had a very intense symptom, it was very severe, it was long-lasting, and virtually every single person who took that substance had that would be considered like a keynote of that remedy, ultimately. So it's like everybody gets that particular symptom, it becomes, we give that symptom much higher weight. And so for every remedy, there's lists of dozens or hundreds or thousands of symptoms, but some rise to the top and some are considered more minor. So you have to look at all of that information when you're taking the symptoms of a patient. The next source of data we have about the remedies and how they affect a healthy person would be toxicology reports, accidental poisonings. Someone ingests lead, what is that? What toll does that take? What effects does that have on the person? So we can look at toxicology reports, not even have to rely all the time on an actual proving that was done, but we can see what happens when someone's poisoned with a substance, what symptoms develop, and we can use that substance, we can create a remedy out of that substance and use that to treat patients who have similar kinds of problems. Like in the case of lead poisoning,